Well, hey there, y'all. Just a quick reminder, this podcast's for fun and information only. It ain't medical advice, and the views are ours, not our employers.
Hello, welcome everyone to What the Health, the podcast by myself and my colleague and friend Nessa. It has been many, many moons and months. We're past the summer solstice, but we're back. And here we are.
Yes, we passed an entire season, spring. It's my favorite season. It's my favorite time.
It was a gorgeous spring, but sometimes it's gray and gross and rainy still. So, yes, this was a very lovely spring, and we're actually having a lovely summer. We have some topics to chat about, I think, based on recent experiences on the opposite side in the hospital. We both have had friends or family members hospitalized that we've been dealing with recently. So, we bring that perspective in. But let me, of course, I have to ask when am I going to get hantavirus?
It's a good question. I I mean, I don't think that obviously we're not at risk for it. California has it sometimes, but
Yeah, so just Colorado in the
yeah,
southwestern part of the state.
but that the kind in the Andes is different, which was interesting. It's interesting to just see and hear about the different microbes across the world and how they behave. I mean, I'm a
And
total nerd with that
right.
stuff, so
Nerd or specialist, and I forget, was there person to person spread?
in the Andes
Yeah.
variety, yes, but not in the ones in the US.
Okay. Interesting. And aerosolized, I'm guessing, is how it's person to spread? Or do they know?
I don't think I can speak to that.
All right. Question number two. What about Ebola? Is it coming?
It's so interesting the way that these scary viruses are depicted on the media.
Hmm.
They are dangerous and they are scary, and I think that for me, it just speaks to how important public health infrastructure
Totally.
is, and I don't really know who's supposed to be running that, like, whether it's a government institution or a private institution or nonprofit institute or a combination or
Right.
decentralized or community level. Those are the questions I think that we're all facing now to figure out how best to respond when it
Yeah.
happens locally in a community, in a country, and how it affects us all around the globe.
Yeah.
So I think that's really the most important question, the details of the virus. Those are, like, nerdy for me, like, I like that stuff.
Yeah, and I think a lot of governments do have their own CDC equivalent branches, and especially a lot of those have done a lot of the early warning detection. But it's when I think there's the lack of coordination, and now, not to get too political, but if you have lack of trust between healthcare systems and governments and agencies, and then defunding, lots of harm in this space. And I'm sure we both have still plenty of friends and working in that space trying to get by on the day to day.
Yeah, I mean, I think they can try and reduce it to politics, but it's not possible because microbes don't care about tribes, and so I think we see this seemingly, aggressive infighting and maybe at the expense of collaboration, but we know it's possible. We saw with COVID how the world came together, so
Totally.
I feel like all that's a distraction. I don't think science is political. I think it's just like a natural law of being here. So I always just remind myself, like, all those people fighting, that has nothing to do with the way I think about things, and I don't get involved in the
Right. And those good
circus.
healthcare workers in every country and every organization are loving what they do every day despite the challenges and doing, I think that we'll call that the HEALTH. Let's talk about what the HELLTH. Let's talk about the patient perspective or the caregiver perspective. And I think just, for readers who haven't connected with us in a while, we're both hospital based specialists. I take care of hospitalized kids and adults. And Nessa is also med-peds trained, infectious disease, and is hospital based. So it's always interesting to find yourself on the other side of the bed, the curtain, the experience.
Yes, I don't even know if there's any sides, but going through the system, as a patient, I think we've all been there, or a patient family, but it really does shape how I experience being a doctor. The most recent thing for me was my father was hospitalized and there were unexpected events. So I learned a lot. The first thing I definitely can't be a doctor for my father. I already knew that going in. It doesn't actually work. There's too many emotions and it clouds any kind of logic or rational thinking. So on that note, first, I think it's really hard to be a patient. We already knew that. Like we've watched it for almost 2 decades now and have had sympathy and tried to bridge the gap and tried to help with the shape of the patient experience in any way we can. But I feel like I could write a novel on how it feels to be on that side. Scary, uncertain, unpersonal, impersonal, I guess. Impersonal. Like you feel like you're just like in a factory. And I think that that general tendency of just like moving patients through a hospital setting has not, maybe it served a purpose. What
Right.
do you think?
I'm trying to remember the quote, the physician who is a patient or the patient who's a physician for themselves has a fool for a doctor or something like that, right? Like I think you touch on a point that you lose that objectivity, right? And I think we practice very similar of being very cognizant and very, we think about our patients a lot in the management and think about them after hours. And we chatted. You called me and wanted some, to talk through some things. And I just thought, yes, it's difficult for us who are medically educated to always comprehend what's going on. What's it like for the person who's not medical? And, I
Can't
think of
imagine.
like,
I
I,
just can't imagine.
and I want to come back to your question, but I think the other really telling thing for me was, and again, I'm working on a concept of a micro practice. When you leave the hospital, with something that is so completely foreign to you and you don't know anything about it and you just that breakdown. And how long was your dad's discharge instructions when he left the hospital?
So I believe that they were suboptimal, and the reason we left early is because of me, mainly because I believe that people can heal better at home, but it did leave a lot of unanswered questions as far as like aftercare. And so first I would say like I appreciate you taking my call because I think that I feel lucky that I'm a doctor and I have doctor friends and I feel privileged for that. It felt like a resource that, like a translation resource. I remember, I think a good way to describe what it felt like is when the doctor came in after the surgery to tell me what happened. It sounded like he sounded like the teacher from Charlie Brown. I didn't even it didn't
Yeah,
register. It went like after it I realized it wasn't like run of the mill, just routine, then I just couldn't hear.
right, right,
And I called you to relay some of that so that you can help me translate. And I think that's the part that when the patient family is overwhelmed, which they naturally are, it's hard to receive any information. It's hard to even know what information you need to receive.
right, right,
I feel like just in our last 20 or so years, the dispo or the discharge instructions is so vital. It's just like trying to prevent people from coming back in to the ER. There weren't many for dressing or for drain or any, there was not much going on. And I feel like if I wasn't in medicine, I wouldn't have been able to navigate the post discharge.
yeah. And I think a couple things are interesting, right? The discharge for your dad was actually fairly standard, like something that should have been templated. That even if you had the capacity to take him out of the hospital earlier, then maybe some families would have felt comfortable. And part of that is I always talk about there's a risk benefit of being in the hospital. When I cite the statistics that preventable hospital deaths number in the hundreds of thousands a year, I think the current number is around 200. There's always this balance of do you need to be here or is the risk of harm tipping, right? And so conceivably, that data, you were comfortable. And so even if the discharge happened when the physician or the surgeon wasn't expecting it, that is such a vital part. So I pulled up some of these statistics because obviously this is my pet project. So 50% of discharges have a medication related mistake. And of that, 12 and a half of those will have an adverse drug event, and 62% of those are preventable. And so, this is the vital time. And I think talking after your dad left the hospital, what I really struggled with was, could you get anyone for answers when a question came up?
Yeah, you plugged in, we weren't really it was a different hospital than his primary care, and it was a routine procedure, so not necessarily we did have I did arrange follow-up, but it wasn't prearranged, like, which is how I
Right,
like it, like, I like
right,
the
right.
I think it depends on the patient and how they are to, like, make the follow-up appointment, which most of them are, but I don't know.
Have the benefit of pulling the doctor card, right? So we had a conversation about this, and I was like, at what point do you say, this is Dr. Mescudi, I'm the daughter of, but we shouldn't have to do that. And what I really appreciated in chatting with you is you were doing it as a family member very intentionally, and it was crazy to me to be like, you haven't heard back basically in a day. One of my direct care patients had an adverse reaction, and I saw her after hours and was like, contact the physician in charge of this part. It took 2 days to get a phone call back.
Yeah, I mean, luckily things worked out and I did hear back eventually, but I feel like it would have been very, very scary if
Yeah.
anything was different than it
Yeah.
was. I just feel like
Yeah.
we were
Yeah.
just very lucky, and yeah, I'm telling of the gap in the after hospital
Right.
that gray zone.
And you said a couple times, well, I think we just are going to have to go back to the ER. And,
I did again. I
and
don't
how many
think
times have you gone to the ER and be like, it's a disaster down here. Why are half these people here? Why are you here for
right.
something that, and then you were like, I think we have to go to the ER. And I was like, I don't think you do, but
I know, right, and I
right.
needed you to help me determine that. So I definitely think that, like, post-hospital, which is where you are looking to, serve, that post-hospital questionable that week after is really just critical to have a kind of support network. If not even network, just a support
Right.
person like I had.
Right, right, right. I want to come back to something you said because I was with a friend after a procedure recently, and it should have been a very normal routine. Number one, I think even as medical people, we know that when you go down for a procedure, well, great, you're going to pre-op. All the consenting is happening. You're waiting. The room has to be changed over. You have to get into stage 1 or stage 2 of recovery before you come back out, and you kind of forget that even a message to a family an hour into what should be a 2-hour case of things are going routine is actually really reassuring. Then I remember a couple of years ago waiting for a procedure to end on a family member, and supposed to be 3 or 4 hours later, and at 5 hours, I'm like, well, there's a code going off, not where we are, but like what's going on. So anyways, recently I was with somebody who had a procedure, and I was still in the room, and this person came back still pretty out of it, who had gotten the results of their procedure from the specialist who did it while they could still barely remember their name. What is going on there, right? And and I think this ties into the throughput, the machinery of the hospital. And this is to no one's fault, or no one wants it this way. Nurses don't want it this way, pharmacists don't, physicians don't, but it's become so chaotic. And in order for hospitals to stay financially viable, length of stay matters. Getting those beds turned over matters. But then the system has become so inefficient. The ER is overwhelmed because primary care is broken down or follow up is broken down. And we practice in a defensive culture where, great, you clinically, everything seems great. Like, had you ended up in the ER, what do you think's the minimum workup that would have been done for your dad's condition as he was?
Yeah, I don't know. I don't think it would have been helpful. But but
But he
I
would have gotten a
mean,
CT,
yeah, maybe,
would have
and
gotten
then
blood
just
work,
like yeah,
an
probably.
EKG.
The usual
Yeah,
stuff.
pulse ox, all the
Yeah,
so
vitals.
yeah, right.
But when you were talking, it made me think of how standardization is important, and yet it can also contribute to, like, feeling impersonal, like untailored, and just like you're moving through a machine. And so I think the nuance there is like there is a system down. We like that it's like this. I mean, there were times when I reminded my father to think of what the ER or the hospital in Tehran or Rasht is like. I mean, there's great doctors in Iran, but I think the system's maybe not the same. So there's some benefit to having standardization, no doubt, and having a way of doing things to make sure like the I's are dotted, the T's are crossed.
Right.
I get all that. I think what gets lost is the like, I'm a human. And I mean, I had surgery a few years ago and it was luckily my first ever surgery, but it was traumatizing. The experience was not comfortable. And it wasn't, like you said, no fault of anyone. We're just going through the motions. This is how we do it. And it does have like a benefit to have that. But maybe that's the part that can be, does it have to only be that way? Can there be another component? Can there be some warming up of the whole sterility of the process? I mean, I'm an ID doctor. Of course, I want sterile, but can we personalize? Because I remember for my surgery, they were like, no coffee in the morning. I was like, no way. Like, just like, obviously, when they give a statement like that, they don't realize that in certain cases, it might be very negative physiologically to go into a surgery in withdrawal. But, I'm not endorsing that people don't follow the rules, but those rules are so standardized. I talked to my anesthesiology friend, and they're so standardized. Like in some places, you can have like black coffee, in some places, you can have this and
Or
that. So
we let babies breastfeed up to I can't remember if it's 2 or 4 hours. I can't remember why I'm forgetting. But again, and when I was like, hold on, no one wants a kid to aspirate, so they can have breast milk or formula up to 2 or 4 hours or clears, and but adults 10, 12 hours overnight. What is this? What is this silliness?
just those kind of things. Like those kind of, I don't feel comfortable, and I'm not like, I don't feel like I think I'm a coffee consumer, but I'm not an addict. I only have one like really industrial strength cup a day in the morning, and that's it.
Mhm.
But like come
I'm
hell
sorry.
or
Who
high
who brought
water.
the French press to our gathering in February? Mhm.
Yeah. Well, it's funny. I took the French press to CCU rounds as an intern.
Well,
Like that was there.
that
That
was
was like,
that was just to keep things going. So yeah, I think it's the depersonalization. Like we examine patients, right? Like who needs to be in a hospital gown? Like at what point can you have your own clothes? Can you
yeah,
know?
and oxygen, like, they keep that on longer, and I think there's a psychological component with oxygen. Like, the patient might feel sicker just because it's there and it dries you out, and I always try and wean people off so that it just feels like they're healthier because they
We're
are.
gonna have to do an entire episode on the bane of existence, which is the pulse ox. Anyone who's trained under me in the last 15 years would probably cringe to hear me go through my regular spiel about the pulse ox. But I tell you what, we're actually going to do that because I have all the data, the research. So I like empowering families. A couple things that I like to do that I would recommend is number one, I always say, hey, there's someone you want to get on the phone. I don't care who it is, family member, friend. Is it a former NICU nurse in North Carolina who retired 30 years ago, but will feel part of the conversation? Because I think ultimately, as a physician, I want as many people to be a part of that conversation. And so if you're a family member and you're not medical, and there is somebody who wants to be a part of the conversation, ask. You have the right to say, hey, as long as it's okay with the patient. When you do your rounds, can I put you on speakerphone so the rest of the family can hear? I would say that any physician who objects to that or any provider, I would really be curious to know why, because there's nothing threatening to make sure that everyone feels they're getting the right information directly from the source.
Yeah, no, I think that's a great tip to remind people of their agency, and just say, "I want this person on the phone," and I agree, like, it should be offered. It will only make the whole process, like, more clear for everybody involved, I think. But there's, on the note of other things you can do for agency, is when you're in the hospital, and this is my dream, I think I think you and I would be great on the next team of designers of hospitals because I think we can design. I'm not just talking about the building. Like, I think the building's important, and there's, like, green hospitals in Singapore and, just outdoor spaces that are actually used instead of, like, the vacant, eerie playground for the kids. But I think, the shaping the experience, like, from when they hit the door to when they leave. And it's not for me, I was like, the hospital design I have in mind, people wouldn't wanna leave. That would be like they'd be like, "Oh, this is so relaxing." But I think what I dream of is to have an experience that's linked to the actual space. So the actual hospital was designed for healing to optimize healing. Like, for example, my dad had a neighbor. There was two. There were not private rooms. He had a neighbor, and my dad thought the neighbor patient was a cop because he kept hearing a walkie-talkie, but it was the hospital walkie-talking into the room, disturbing the patients. I'm like, "No, no, Dad, I don't think people."
Can't believe I'm trying to remember the last time I saw non-private rooms though. You know,
Mhm.
even that in of it by itself. Didn't you mention a statistic about when you have access to natural light or a window that actually shows something? Did you were you telling me about some study or some data? Because I think that's the
Yeah,
other thing, right? Like when you in a room where you don't have a view, and a lot of hospitals in Colorado have been very fortunate to be built recently in the last, 10 or 15 years. Almost every room is gorgeous, even if you're not looking at the
I'm
west and the
really
mountains, like
impressed with, yeah, Colorado's impressive. Some of the private hospitals there have, like, a fireplace and, like, you view the mountains, and I think they've got it figured out and we could model, but I also just think the beeping, the sounds, and not just for the patients, but personally for me, was traumatizing as well and not conducive to a space to optimize, like, my thinking and my clarity.
yeah,
And then the food, don't get me started on. But also the other things that I always recommend, because sleep is so important. I say bring an eye mask, ear plugs,
totally.
a comfortable blanket, even your PJs, like get out of that gown, like you were saying, and do what you can within your power. So I'm just saying, bring all your rituals to help you wherever you are. So I take them with me in the van when I go
Right.
camping. And like I recommend you take them, especially if your body is sick and you're going to the hospital. You need to like double down, quadruple down on the things to help you.
Yeah.
And
Yeah,
but I think people don't do that. They don't, what, or from my observation, it's not common for people to do that, to think that they could bring some of the stuff that helps them, supports them at home, and that's why obviously they wanna get home, but, you can try and do that bridging, I think.
right. It's so funny. I think initially we would go to do an admission and we'd see, oh, the suitcase is packed. Oh, they're expecting to be here. But now 100%, you may just be there for one night, but why not have especially a pillow? I love an eye mask, something, for those creature comforts. And even if it's just for that one night, it's vital for health and restoration. One of my other favorite thing is shutting off monitors in the room, which interestingly has become pretty difficult in the last couple of years. And I don't understand why. So I don't fight that much anymore. But who really needs Q4 or 4-hour vital signs overnight? Many don't, right? And so it is maximizing that patient experience. I think the other things I always kind of encourage is get access to the EHR and get on your portal and read everything.
I'm glad you brought that up because I had that, and had I not had it, there would have been a lot more questions. And I got it almost immediately. I followed all the steps on, they gave like a little booklet and it said for portal access, it's QR code, and I got on really quickly and had access to everything so I didn't have to like pester the nurses who were busy. Which, by the way, I'll say it was a community hospital. I appreciate community hospitals over the big academic ones because the nurse was born at that hospital.
That's awesome. I love that.
And I'm so like, there's something really sweet about someone who was born there, who lives in the community, who
Yeah,
works there, who serves that community.
totally.
There's something like a dedication to that that I appreciate
Yeah.
a lot more than, the bigger. Not to say that those centers aren't important. They are if there's specialized need for care, and it's something that the smaller hospitals don't have. But I'm more like a smaller hospital
Yeah,
type of
no, for
person.
sure, for sure. Yeah, no, it was great because I think I had some questions and we went back to the portal or you went back to the portal. I would also say for me, the other caveat is everyone should know where's their source of truth. I look at my own, record here in Denver. Yeah, there's one or two things missing. They're not important things that have happened in the past, or that medication is no longer being taken. And so I encourage everyone to not trust the EHR. Anytime you say, "Oh, it's in the computer," you don't know. I mean, think about like anyone who sits at a computer. Did you mistype a word? Well, 5 milligrams versus 50 milligrams happens all the time. So not all the time. And again, I'm a hospitalist, right? This is my passion. This is, what I do, but I want people to feel empowered to know that if you're relying for your care to be on something that you don't actually know how to read, look at your Epic problem list or your Cerner problem list. And if there's 30 things in there, something needs to come out, right? When I meet people, I say, I like to call it, this is the truth and lies portion. Let's see what's true and let's see what's a lie.
That I love that. I think that's a really good point. And what it made me think of when you were talking about it is how we as doctors collect our information and synthesize it to then be able to give our most informed recommendation with the data that we have in this moment. So I feel like that just describes being a doctor that's very fluid. So one of the ways, for example, that AI can't do this is, I don't think yet anyway, is there's all this information in the chart. And I think we learned in our training how to take that information and pull out what is relevant to what is happening in front of our faces in this moment and then synthesize it. You can't just have nursing notes like this or all the transfer notes. We've all been on that side where received we've been on the tertiary center side, we've been on the hospital side, and we've received different things in different scenarios. It's not about information or the massive amount of information which AI can luckily collect and collate. It's about which of that is written. How do you like dovetail that with what the human is saying to you and what the new data is saying to you?
Right.
The like
Right.
real time data. And then that's the synthesis. And I think for infectious disease, we're such dorks. We're like inspectors gadget style. But like we do almost like an morbidity mortality on
Yeah.
every case. Like all our
Right.
concepts are collect all this data. Okay, weed it out, collect all this data from the human, weed out what's important, put together something. And then for today, this is what I think, but tomorrow it could change.
Right. It's fascinating. And I don't know if this will make me feel old or not, but I remember it was taken care of. Somebody who most of us had taken care of at some point. And I remember I was looking for something very specific in this person's past history. And I remember I called down to medical records and she's like, she's like, do you want me to bring volume 27 of the chart up? I mean, they're this thick each. And I was on number 27 and I said, I mean, just get through number 27. And if it's not there, I'm giving up my search. And so lo and behold, volume
It was
27, came up and sure enough, there it was. Well, that what is on the list. I also just think it's the culture where we trained. One of my favorite memories, I think it was a second year attending, and I had this fantastic resident, and it was coming towards the end of June, and you love it when you finally feel smart, and the residents think you're smart, and you finally feel comfortable. And this resident was just like so exasperated. Remind me of myself finishing residency because he was like, I don't understand how I'm going to really be able to do this job. I describe it like this. It's like the Matrix. All I see are green numbers and letters just falling down over a curtain. And at some point, you'll just be able to tie together 15 random facts that expand 5 years of data because it is just, you know what you're looking for. But I said the important thing is you have to know if you're discarding data, why, and why you're keeping the data that you do, because all data has value. And if you're making mistakes, saying, oh, this is not important, that could be the important thing. It's like, who was the professor of medicine or chair that would do would work through it? And I said, that's the goal to get to is a physician who is able to take great care of patients by becoming a data analyst.
That yeah, you made me think of when I was an intern, and my senior did that, like, took my I went and talked to the patient, like, had handwritten some things, 'cause that we were handwriting then. There was still not electronic notes. There's the dating me. So and actually, I handwrite still, just to get back to how important that is for my brain to process, and she helped me Gina, she helped me put it all together and, like, very clear made a concise summary, and I was shocked. I was just like, "No, I don't think I can do that. My brain is not designed to do that yet." But that's what the practice was. And, like, that's why the summary statement's so important to me because it's not just a summary statement, it's literally mind training so that you can get so much practice in and you might miss some things, obviously, but to really just synthesize everything, complex information, those parts of your brain are all working together, and that's what medical training was, and we had really great training. We know, like, the critical thinking and just the collaborative support and the care. We're so lucky. But, on that note, I feel like another thing that happens, not only being a data analyst, is I've been thinking about it more lately, is how many human stories we've heard.
Mhm.
I mean, you cannot count, and each one completely unique. And so it's just a listening service that
Yeah,
is
it's
training. It's a training to listen and to try and piece together from the listening and from the
yeah.
observing.
And I think that's an interesting point because, that should be the most kind of important or thing that drives us every day is the engagement with people. And so I think if you are a patient or a family member and you're with a physician who's not showing that, it may not be them, it may not be where they started in their career. Who knows what's going on in the back end, but ultimately, if anyone wants to join this profession, I'd say that's the best part. So,
That I think I told you this when I was going through it, is it the actual structure and the institution and the design and the sounds and the way that the, like, system's set up is not optimal, but what really and in this case, what really helped us were the doctors and the nurses and the ancillary staff. It was like, without that, there would have been no way. And, like, the nurse, like I was saying, the nurse was born there, was so encouraging towards my dad. My Everyone loves my dad, and just, like, really sweet and really obvious caring, even
yeah,
though they were busy. Like, it
yeah,
was so obvious they had a bunch of admits and they were busy but that's it. I was like, "We're okay. We're in good hands." Like, all the rest of it, is the same in all the hospitals.
yeah,
So, all I want is people who care.
yeah,
I
absolutely. And
mean,
I think,
obviously, we need competence and we need,
yeah,
all those things, sure, but what's the distinguishing point now when you're deciding where you're going?
what's closer? Who has availability? What insurance do they take? Who has beds? Right. All right. Change of gears. Ready for it? I'm going to show you. Back there is my garden. And I just mean that one pot that has the marigolds.
I love it.
But that's also lettuce and chives, basil, sage.
Yeah.
Yeah. So I was surprised how easy the lettuce has taken off and grown. So I've had some fresh lettuce with our meals. This is my slow cultivation of gardening
Mhm.
compared to what you're doing. So I feel like
Yay.
you'll have to send us a small video clip of your outside garden so that people who are following us can see how my one pot pales in comparison to your entire
No, no,
yard.
no. I mean, I think I would say, like, it's definitely like we're moving away from the competition
Oh, yeah, no, for sure. Yeah.
mindset
That's
and
it.
comparison mindset, but I just feel like you're showing everyone how a perfect example of how you can do that, and it kills I hate using these violent terms, but kills more than one bird. Two birds with one
Yeah.
four birds with one stone.
Right.
Because
Right.
you're like, not only are you getting outside, not only are you tending to planting seeds literally and metaphorically for something and tending to something that will nourish you ultimately by eating it, but also by just being around it. And I know that sounds insane, but I'm sorry, but I've been deep in experimentation for I don't know, many years. I would say I had a garden in fellowship, but really definitely in the past 3 years where it's a relational thing. It's like, not only does it help your gut, which gut health actually I learned, with bowel health being so important for anyone that's in the hospital, for any family members, because it's linked directly to your nervous system. So bowel health, gut health. So yeah, kills too many birds with one stone. So why not do it? It's like, and you're proving that you could do it. So I have so much passion for when people want to experience plant life. I know like a lot of people, especially here, love animals, which I love too.
Like
But
beef, chicken.
yeah, no, but I think that's very exciting. Like, I'm so into herbal teas, and actually, I want to say lately I've been experimenting with yarrow, the leaf, and I was drinking it for the first time yesterday, and I had my book club, and I felt really like tired. And then I went back and saw that it has sedating effects. So that was my like end of one. Like, wow, I should drink yarrow when I'm going to bed, not.
Right, that's funny. It's funny. I'll give a plug and I'll post this in the show notes, but I think I can't remember if I told you I watched this episode on Netflix called "This Is a Gardening Show" by Ryan Gallifrey. I'm gonna mess that up. 15-minute clips. It was fantastic. It's hysterical, and it was eye opening. But I've also seen, especially with a lot of the emergence of the Shinroku work, the connection and the way that the gardening, being in nature, being by pine trees, actually has effects on cortisol levels is quite fascinating. So yes, I appreciate the correction that it is definitely not a competition; it is inspiration. So, but yes, it's been fun, and it's also fun just to come out and get some random herbs to throw on eggs or something like that. So
I know, yeah, there's something about it, just like, I'm gonna go and, even I feel this is kind of an era of I mean, it's always been for me, but an era of high autonomy, and it feels good to go to your backyard and just get a salad and then add other proteins, which is what I did today. Just made, like, a big bowl of fresh greens and I added beans and broccoli and radishes and lettuce. Add whatever you want. Just make a
you
bowl.
do you. Yeah. So, well, good deal. Well, it's good to connect. We've talked about some more regular contact, and yeah, this is a great conversation. And again, I think it's disempowering to be on the opposite side, and that makes me want to empower people more to feel comfortable in the spaces in which you and I operate regularly. So,
Right, and I think that just the fact that you were that support person for me is so indicative of what you have to offer
thanks.
like, for anyone going through the same thing, and I really feel we've always felt so passionate about that transition space, probably because of our med peds training where we're constantly going between worlds, and there was never
Totally.
it didn't seem seamless in between, even though all of us are children and
Right.
we all become adults, like, it's like a continuum. But, yeah, I think that the fragmentation of spaces, it sounds like that's where you're looking to spend a lot more energy in.
Yeah.
And
Yeah.
honestly, like, after being in the front lines where we is, like, as downstream as you can get, it makes sense that yes, we were in the system, yes, we learned a lot, but we also have our own independent ways of growing and learning as
Totally.
humans and doctors. But now we take that wisdom of what happens downstream and move upstream.
Yes.
Like,
Absolutely.
what do we do before we get there? We're all potentially gonna get there, first of all.
Right.
Like, we all sickness and aging and death is just something it's just biology.
Yeah.
Like, and as a biologist, like, I study
Yeah.
it, so I'm not afraid of it. But, yeah, I think finding that comfort of the continuum of life and who can support and nourish you and how you can find ways to nourish yourself. That is like the theme of this year.
I love it for sure. So, well, it's been fun, and yeah, I'm also very glad your dad is doing well. So,
Me too.
is he?
He's a good 80-year-old.
Yeah,
Good.
yes, he
That's
is.
how we
Yes,
say
he
it, right?
is.
Like, Yeah, so
Yes, exactly.
I'm trying to learn, when I see patients, I'm always like, "Would I be like?"
I know. What's the term that we used to use? Appears younger than stated age or appears older than stated age.
My
You know, there's
father
a whole
appears younger than stated age, and you know what other really great thing about him? I noticed he doesn't like, that is a skill.
that is, yeah,
The
that
man
is
has no complaints.
that's incredible. That's
Okay,
incredible.
that's not entirely true, but you know what I mean, like,
Yeah.
he wants things done in a certain way,
Yeah,
but
yeah.
when it comes down to it, like, if you look at, like, the grace of just what you're going through,
Having
like,
gratitude.
at
Yeah, he's
some
like
point, you have to be like, "I'm going through this," and not resist, and so he
right, right.
has that kind of Buddha quality, and I think that was good for me to see. Obviously, we all have, like, risk or strengths and weaknesses at different times, but, yeah, finding the strengths in each other, especially when it's, like, a
Right.
really hard time is
Totally.
a
Totally.
practice.
For sure. So, well, enjoy the rest of your day. I'm sure it's gorgeous out there. I'm gonna go work on some admin work and then get back out into this beautiful afternoon up here.
That sounds good. Happy summer, happy
Yes.
solstice, and we'll, I'm sure, be in touch so soon.
Looking forward to it. Chat soon.
Thanks for listening to What the Health, cutting through the chaos of modern medicine one story at a time. Follow us at whatthehealth.org, HELLTH, or on Instagram at WT_HELLTH, and catch every episode on Spotify and Apple Podcasts. Click the link in our bio and stay tuned for more.